Hello, welcome back to Catapult Your Career, where we delve into the reality of various careers and explore practical advice for numerous professions. And in this episode, we're focusing again on another different career. We're focusing on the world of audiology. And I have none other than a really good friend and former colleague in Nicola Yarnall. So how are you, Nicola?
I'm very well, thank you. Thanks for inviting me on.
Thank you for coming. And of course, you're here as you're going to speak about your breadth of experience as an audiologist, and you've kind of done it in various guises, various roles. But just to start us off, why don't you kind of just give us a brief introduction to yourself and your background?
Okay, thank you. So, I'm Nicola. I started my journey as a student audiologist back in 1988. So before you were born.
I didn't want to say it.
Yes.
You knew I was going to say it, so you. But yeah.
I can honestly say it is something I've enjoyed from the day I started and still currently enjoy nearly 35 years down the line. So I'm pleased to be able to speak about it really, because it's a role that I fell into. I'd left school, had no idea what I wanted to do, just did my GCSEs. I went and worked in an office. Because you used to just literally go through the newspaper and find the job adverts, apply for jobs. I went to work in an office, quickly decided that wasn't for me.
Mm-hmm.
And my mum worked in the hospital, in the local hospital. And she said to me that there's a student's post going in the office over the road. So she arranged for me to have just a day shadowing, just observing what they do. And so I went and spent a day in the hearing aid department. And I absolutely loved it. I thought it was scientific. It was people orientated. It was the team who worked there were really interesting. So I applied for the student position and was accepted and started my college journey. And that's where it began. I mean, it's something that's now, it's been called various things. When I first joined, it was called a physiological measurements technician.
Right.
Then I was called a medical technical officer.
Yeah.
And now we're under the healthcare science branding, and we're a specialist in audiology.
Okay.
And, to me, it is one of the specialities that starts from, so hearing now is screened at birth. That is screened as soon as 6 hours after the baby is born. So we're in there as one of the very first things, testing someone's hearing at 6 hours old, and we could be with that person until the day they die. So it's unbelievable. I think I work with both ends of the spectrum. I've been in charge of the newborn hearing screening program locally within Mid Essex when it first came out in 2004. And so I've been there sort of testing babies' hearing at birth, picking up if they've got a significant hearing loss, sharing that with the families, and fitting the hearing aids to those babies, seeing those babies hear for the first time in their life, being part of their journey. And because I've been around such a long time, I've even now worked with those children I've diagnosed with a hearing loss and fitted hearing aids to, and gone through their school life. I've worked with them because they've been to speech therapists, say, for instance. So I can't think of many other specialities that you would have that experience.
Yeah.
But audiology is something that assesses hearing, it assesses balance systems, and other associated things like tinnitus, like hyperacusis, which is a sensitivity to loud sound. We assess people who have got misophonia, so those people that hate the sound of people eating, for instance.
Yes.
Some people can't even bear to be in another room with somebody if they can hear them eating. It impacts their life so much. We also so as well as diagnose hearing loss, we manage hearing loss as well. So we'll assess if somebody needs surgery to improve their hearing. They might need a hearing aid. They might need a cochlear implant. They might need a bone-anchored hearing aid. There are so many different aspects of audiology. I'm still learning now, almost 35 years down the line. and I'm still loving it. So I think if you are science based, but still want to be with people, you can go into research as well, of course. But I think it's something that could interest a lot of people if they know about it.
Yeah.
You know, it's one of those jobs that unless you've been part of it, or unless you know someone that's in it, you don't really hear about it very often. So keen for this to be shared, really, so that people can get to know about it, because audiology is something that's never going away. People need to have their hearing assessed. They need to be looked after. And particularly with an ageing population, we need to make sure that people, have their hearing improved as much as it can be. It helps with dementia. There's a lot of research now showing that people with untreated hearing loss are more likely to have the effects of dementia. All sorts of things.
Yeah. And I think everyone, including me, who's listening, is probably thinking, I can see why Michael invited Nicola onto the podcast. Because
I always know when to stop talking about
no, it's all good, but it's genuine. Your joy and your passion for the career. It's a reason why I asked you to come on, and I think, based on what you just said, that's exactly the premise of this podcast, to share things wider. Because, we snigger at, like, oh, people, some people won't even know what a lawyer is, or bankers or stuff like that. You think, that can't be possible. But if some people don't even know what kind of those careers and those paths are, it's even more unlikely they're going to know what an audiologist is. And people might be really well suited for those careers and those paths, but it's always hard to do what you can't see, or what you can't hear. And like you hit the nail on the head. The premise of this podcast is twofold, really. One, to kind of interview quote unquote careers, to kind of share that understanding to others who maybe are stuck in a rut in terms of their jobs, and actually find out about other paths that they can transition into. And then equally, some episodes are more focused on wider topics like values or tips to transition careers. So, it's really good to have you here and kind of share your experience. And you mentioned you started touching on some of the roles. What if you could take us through, like, because audiology is obviously quite a big field in itself. What are some of those roles, from more like an entry level to perhaps where you are now in a more senior position?
Yeah. So to be you've got two different routes, I guess. You've got the sort of private hearing aid dispenser route, which you can go down, and you can go and work for just, the big hearing aid dispensing companies, Boots, Specsavers, that sort of thing. They'll have their own training program. And then you've got what I would call, because this is where I come from, a medical audiologist. So you work more in a hospital-based NHS setting. And you can access that now. I mean, when I was doing it, it was a day release at college. It's not like that anymore. It's a degree. But there are apprenticeship routes as well. I mean, it will vary across the country. If you've already got a degree, there's a master's route, and you can go on to do a PhD. But there's also the sort of newborn hearing screener roles, or the hearing care assistants, are a sort of a lower level than a degree level. So there are all other avenues into it. And to be a newborn hearing screener, it's the most lovely job. You work on a maternity unit, and you literally go around and with specialist automated equipment, and you test babies' hearing all day. The equipment does everything for you, and you can access that at a GCSE level. And you're trained. There's a national programme that provides a training, and you train in the role. So there's that. You've got hearing care assistants. You've got that in both private industry and national health quite often. And then you've got the traditional audiologist, as it is now, with going to university, doing your 3-year degree, and then coming out of that and then going into a sort of a newly qualified role.
Yep.
And then you would be taking part in working in ear, nose and throat clinics and testing people's hearing when they're there to see a doctor. You'd be fitting hearing aids, testing people's hearing to see if they need a hearing aid, doing hearing aid repair clinics. And hearing aids now are really quite complicated, really sophisticated systems that require a lot of digital programming, and that in itself is a whole other science to do the hearing test. So it's a very wide, I suppose, service, and you can specialize. So you could go into, paediatric audiology, which I do as well, where you specialize in testing children and babies from 0 to 18, and depending on a person's development or their ability and their age, depends on what type of testing you can do. And some of it has to be objective, and some of it, and much of it is subjective, and depends on behavioural responses and all sorts of things. Yeah. So as then people get older, and their development allows it to come on, then they, it's a traditional headphones on, press a button when you hear a sound type thing. But you're measuring someone's sort of sensitivity to see what is the quietest sound that they can hear across various frequencies, and then determining, is their hearing within the normal range? If it isn't, then what part of the hearing system is that hearing loss coming from? And then depending on where the hearing loss is coming from, depends on what you can do to treat it. So it's quite a sort of systematic approach. And then, that takes you down whether it's surgical, medical, hearing aids, what type of hearing aid, depends on what type of hearing loss, cochlear implants, all sorts of other middle ear implants. There's a variety of stuff out there, and it is constantly changing.
Yeah.
So it's quite incredible what's available. Not all of it's available on National Health. Some of it is specialist, and some of it, you have to meet criteria to be able to have it. But it is, a huge, vast array of stuff that you can get involved in. And one of my sort of favourite jobs, and it'll be something that some people either love it or hate it, is wax removal as well. Because earwax is a problem and causes a lot of hearing problems. Yep. And actually, one of the things I've gone into is microsuction earwax removal. And it is the best part of my week. Because it is the most satisfying. People love having it done because they walk into your clinical room, can't hear, their ears feel terrible. They can hear their own voice in their head. They're really uncomfortable. You take all the wax out and they walk out and they, absolutely feel like a completely different person. They can hear again. Their ears feel lovely. They haven't got that pounding noise. It's weirdly, out of all the stuff that I've done, people tell me they love me once they've had it done. So
I could see why you're doing it then. If yes. all these compliments, and I think there's I can see how it can be like satisfying, and there are the weird people in the world who like the popping pimples and all that stuff. And
I don't like that.
Exactly. So I can see where it happens, but I suppose it is underrated in terms of like your hearing. If you can simply in the space of like half hour, if that, change someone's ability to actually hear. I suppose it's underrated actually how much of an impact you can have on somebody's life. And you mentioned right at the beginning about it being people orientated. I think that's a common theme that comes through. Yes, there's a very much a systematic and sciencey approach that kind of comes to treating people, but there's very much at the very core of what you're doing, it's always dealing with people, isn't it?
It is. And it's not just the person and then giving them a hearing aid and it makes it better. It's the family around them and how they communicate with that person. It's that person being able to access work, being able to access education. We've got teachers of the deaf that we work alongside. We've got interpreters, all that sort of thing. So it's having that sort of knowledge of all the other bits that come with it, to enable that person to hear and to live as well as they possibly can. And it's vitally important, because if you don't, then that person can't access education, work, social events, that sort of thing. And then, that can have a real impact on someone's life, their mental health, their, mental well-being, all of that. can be impacted. So if you can get that right at the start, and particularly for children that are at school, we see a lot of children with glue ear, with temporary hearing loss. They can get speech delay, they get behind at school, all sorts of stuff. If we can diagnose them correctly, give them the right strategies to enable them to overcome it, then the impact of it is nowhere near as it would be without. So, you're working with parents, to work with the schools, to work with the child, to do all sorts of stuff to enable them to hear as well as they can.
Yeah, no, definitely. It's a real, like you say, it's a real ripple effect that you cause. Like, it might be one small action that's taken for granted, but it acts as an enabler for education, mental, society, socialising, and all the rest of it. And you kind of mentioned quite a few of different tasks. I suppose for an audiologist who was in that role, what if you could, like, I know it's a bit of a rough question, but like, what would you say the average week looks like for an audiologist? What are some of the tasks and things they could maybe be doing in the average week?
So, I mean, it depends, because there are many different areas of audiology that you can work in. But I suppose, in my experience, when I've worked in hospitals or community settings, it's you are an autonomous clinician. You are working on your own in terms of you have your own patient list. You will be, taking a medical history, doing hearing tests, looking at people's ears. So you're doing the diagnostic part of it, and then you're interpreting the results, and then you're discussing the outcome of those results with the patient and their family, and then you're agreeing a treatment plan. So it's a whole thing. So it could be, when you get to probably a senior audiologist, you're doing that. Before that, you're probably assisting other audiologists, or you're assisting a doctor. So you're doing the testing part and then handing the patient over then for the other bits to be done. Or you could be fitting hearing aids. So all of the testing's been done. And then somebody's coming in to have a hearing aid fitted for the first time. So you're going through making sure the hearing aid's performing as it should do in that ear, and you have to do certain tests to do that. You're then explaining to the person how to wear it, how to put batteries in, how to clean it, how it's going to work in the outside world, which is actually quite noisy, that you've not heard for a long time. So as much as it's scientific, it's also a bit of counselling. And you have to utilise a lot of different skills, really. Showing how to put a hearing aid in, all sorts of stuff. And also giving somebody the confidence to wear it, because the trouble is that the hearing aids often have a stigma attached to it, that it's only old people, that it shows I'm getting old type thing. But that's not necessarily the case. Hearing aids can be fitted at or needed from birth, and a hearing loss can come on at any time up until the day we die. So it's not typically old age, but unfortunately that stigma is still around. Now that hearing aids are getting better, I mean, when I first started, hearing aids were, could almost be worn on a belt with a wire up and a receiver in the ear. And that's what I think people often remember that. Before that was ear trumpets and all sorts of things. But now, things have moved on massively. You can get hearing aids so you can barely see. You can get the tiniest of little devices that are very comfortable and are not old-fashioned beige-looking things. They're, quite sophisticated, really. But they need to be a certain size, because there's a lot. It's also, they're almost like a mini computer. Because what a hearing aid will do is you will input into the hearing aid what the hearing loss is. There will be prescription added to that result, and the hearing aid will then assess the sound coming in. It knows what your hearing is like. It alters amplifies what it needs to amplify and sends it back into your ear. So it's very complicated. And it has to cope with all the background noise and all sorts of things, sudden loud sounds, quiet sounds. So it's a very, very,
It makes me kind of think about even like AirPods. Obviously, they're not the same kind of principle, but some of the most modern AirPods, like you can have transparency mode and all the rest of it, where they listen to the sound coming in. So you could be at like a rock concert or something, front row, and it's like roaring loud. But if it's on a certain mode, it will listen to the sound, and in like a split second, it will dumb that sound down. So then when you hear it in your ears, it's at a more manageable level. And
Yeah, that's right.
it sounds quite familiar, really, to how a hearing aid operates.
Yeah.
And I suppose just further on that kind of switching focus, I suppose, back to the people who are listening, who are, they're hearing the different aspects, different what an average week looks like for an audiologist. Perhaps they've heard some of the educational requirements, and they think, they hear it's people orientated, and they're actually quite keen on maybe finding out a bit more information or pursuing this career. You started to talk about skills for an audiologist, and obviously there's various different roles in audiology. And the biggest one was kind of communication, that you kind of spoke a lot about, and helping almost coach and counsel people along that journey to feel comfortable wearing hearing aids or doing other things. What do you think are some of the other skills or traits that are would kind of suit someone quite well to enter in that industry?
There's definitely the scientific sort of mind that you need, because you're dealing with decibels. How can I describe it, really? When you're measuring someone's hearing, you need to take into account, frequencies, all that sort of thing, intensity, the equipment we use. So it's quite practical in terms of, we use an audiometer, or we use it software through a computer to test people's hearing. We calibrate equipment. So it's quite an equipment heavy service. So you have to be quite good, dexterous, all that sort of thing. What else? As much as your people skills, as much as your analytical brain, because you need to work out, what are your results telling you? You need to be able to work with people to enable them to perform the test. That is not always easy.
Yeah.
So it's having good sort of skills, being able to sort of work with different people at different levels, different languages. And then it's also the sort of counselling side of it as well, because you've then got to almost break bad news sometimes. I've been in a situation where, I've had to give parents of newborn babies news that their baby is profoundly deaf. And that's really hard.
Yeah.
Really hard. And you could be telling, somebody that thinks their hearing loss is temporary. That isn't. It's a permanent hearing loss. This is never going to get better. And that can be, quite devastating. So it's having that compassion and stuff to put yourselves in that position, and to try and do your best for that person to make their life as good as it can be, and that make them see that, this is not the end of the world. This is what we're going to do. And I suppose through my experience, I know that if we diagnose a baby with a hearing loss very early, and we put the hearing aids on, all that sort of thing, to enable them to hear as best as they can, to put the speech therapy in place, to put the support in place, they are more likely to be keeping up with their peers, and still to be going into mainstream school, and still to be doing all those things that you would expect as a parent. So, and I've seen children come through it. Whereas probably early on in my career, when babies weren't picked up at birth, and they weren't picked up till they were 2 or 3 years of age, there was a massive delay, and there were speech difficulties. So I suppose it's being able to share with parents and reassure them that, we can do something about this.
Definitely.
We can support you, and good things will still come.
Yeah. Yeah, and I think that's that's a really kind of core. It just reinforces what you said about the role being people orientated, and you would associate most kind of health and social care roles being that, but that's a real practical and tangible example, I suppose, of how people can put themselves in the shoes if they were to pursue a career in audiology, like the vast range of conversations they might have, and that is actually a very realistic conversation that might happen when they have to kind of give and break that bad news. And it kind of links very nicely, I suppose, onto an element I was wanting to cover in terms of the most perhaps rewarded and most challenging aspects of audiology. And that you kind of articulate quite a challenging perhaps element. I suppose what are some others you think that are quite the rewarding and challenging bits of the role of audiology in terms of the various roles you've had?
I think in terms of rewarding, the best thing is being able to give people answers.
Mm.
Quite often people have experienced problems themselves for a long time. It takes people a while to actually action it, go and see their GP, say there's something wrong, and then be referred to somewhere. And then you sit down with them and say, yeah, well, look, this is where your hearing is now. This is where it should be. This is what I think you're going to have the problems. These are the problems you're going to find. And they go, yeah, I thought I was going mad.
Mm.
You think, no, absolutely not. You're missing out on this. This is the consequences it can have. This is what we can do about it. So a lot of people really struggle and don't say anything for a long while. So they struggle at work, can't quite hear conversations because the office is busy. And they'll often excuse, they think, well, I can hear that bit all right, but I can't hear that bit. So it can't be my hearing. It must be something else.
Mm.
And it suddenly dawns on them when you go through a diagnosis that, yeah, I wasn't going mad, but they might have spent two years going through a difficult phase, and it might have impacted on their work life and their family life or whatever, quite a lot. So I think the rewarding part of it is helping people to see, that there is a problem. They haven't been going mad, and we can do something about it.
Yeah.
In terms of, I think particularly when I see young children and parents come in and, they're not speaking, they're not responding to their name, all sorts of things. Sometimes is there a developmental disorder or is there a hearing problem?
Mm.
What can be challenging is when parents want it to be a hearing problem because the alternative of it being a developmental or a social communication problem is more worrying for them.
Mm-hmm.
And for me as an audiologist, I have to work out, what do I think parents want? Because depending on if they want it to be a hearing problem as opposed to a social communication development problem can depend on how I deliver my results.
Yeah.
Because some people are just relieved to find out that their child's hearing is normal, and some people are not relieved to find out that their child's hearing is normal because actually it means it's a problem that's longer term.
Yeah. Yeah.
So you really have to, and the same can happen actually when you've got a profoundly deaf family. I've been in a situation where I ask quite often, I'll ask the family, are you happy for your baby to be hearing, or are you happy for it to have significant, be profoundly deaf or be deaf like yourself? Some families want their child to be deaf as well, because they're living the life the same as they are.
Yeah.
So you just have to have that little bit of background to know how to deliver the news. That's some challenges I've learned.
Yeah. And, I often sometimes talk about emotional intelligence, and my definition is just, what is it like to be on the receiving end of you?
Mm-hmm.
The way you're delivering your message, the way you're having that self-awareness of, so if I deliver my message, I'm gonna kind of land this way, and if I deliver my message this way, it will land differently. I suppose a question for you, and I can ask this knowing you perhaps, do you appreciate the amount of kind of understanding and intelligence you have to even be able to think about how you frame conversations with people? Because that, it takes a lot of self-awareness and understanding to kind of deliver those kind of, those messages in those kind of high, almost stressful situations, I suppose.
I do now. I probably didn't do when I started my journey. I probably thought, and I'm pretty sure I did, that to tell somebody they've got normal hearing would be great news. And I couldn't probably understand why people wouldn't think that was a good thing.
Yeah.
But actually, there's more to our development and everything than just hearing. And no, I think that's something you learn.
Yeah.
But it's something that maybe it would have been nice to have been told about earlier in my journey as a student, so that I've got that awareness. Because it's something that's dawned on me as time has gone by.
Yeah, and it's funny you say it, because I often ask the question when people, if you did have your time again, and obviously you've got a kind of a vast amount of experience in the world of audiology, but if you did have your time again and you were a young 16, 18-year-old Nicola, like entering audiology and entering that hospital, like what were some of the words of advice, or what would you tell that young Nicola if they were to enter the industry again?
I think it would be just to experience as many different aspects of audiology as you can
Mm-hmm.
early on, and broaden your horizons as much as you can, so that you've got some knowledge of all the different aspects.
Mm.
Because you can, go into your student's role, and I mean, to be fair, it's different now. So the degree training is different to how I did mine, but probably I settled in one department and stayed there because I lived near there. I loved the team and I stayed there for a long time. I didn't really venture out.
Mm.
I took advantage of different opportunities within that local area and did different things, but I probably wish I'd gone to London, worked in some specialist centres early on. If I did it again, that's what I'd do.
Yeah.
I wouldn't, nothing much more, because I've thoroughly enjoyed my career. I still enjoy my career, and I'm still keen to learn different things. But yeah, I think that would be it.
Nice. And just out of interest, what do you think stopped you from doing that and reaching out and going to London and kind of doing different things? What do you think stopped you from venturing further and wider?
Probably I was just comfortable.
Mm.
I could walk to work. I could still go out with my friends afterwards.
Yeah.
I live nearby,
Yeah.
and I probably, I think that was it. I think I was just comfortable in what I was doing,
Mm. Mm.
which is not a bad thing, to be fair, because in audiology, it's quite funny actually. It's very difficult to recruit in audiology. There are not enough audiologists coming through. So for us as recruiters now, we want to get people and mould them so they get married and live in the local area. They have children that go to school, and which means they don't leave. So I'm on the other end of that I want to, to keep these people because they're comfortable and their work-life balance that fits.
Yes. Yeah.
It's funny. That's the sort of discussions we have now. Right, well, how can we make these people stay? Right, let's make it really,
And I think, like, honestly, well, first and foremost, it's fascinating, but like, thank you for being so transparent, because I think it actually really helps people to understand both sides of kind of the coin. And I think as soon as you become a manager, and we've both kind of had various kind of managerial positions, you look at the world and you look at recruitment and employment in a completely different way. So if you've only kind of sat one side of a table, as soon as you become a manager, you think about, even when you then go for jobs, you think about things in a completely different way. And I think that bit about kind of venturing out your comfort zone is absolutely golden, and it's something, and it often is when I've asked other people in terms of their careers and what advice they would have given, they're always pieces of advice that can kind of travel to any industry and any position. And that is the biggest thing for me, in terms of coaching and helping like people transition, is rather than just like being happy with certain discomfort. So you're comfy, you got your comfy slippers on, I always call it. You know what you're getting. You might not have quite, 80% of the role is what you enjoy, but you get to work from home a little bit. You don't completely enjoy it, but it's comfy and it's easy. I can rock out of bed and get to work in 10 minutes. Think of like, do you really want to like look back in like 30, 40 years, God willing, that you live, and you think, oh, I lived a nice little comfy life and I just did my little job and I stayed in my little town. Like, you have no idea. And I think I posted this recently, like, beings have no idea of how much we're actually capable of doing. Like, you look at like people, whether you believe it or not, landing on the moon, you look at Bill Gates, you look at these people who built absolutely humongous companies from nothing. All of us, MLK, you look at injustices and movements, social movements, each and every one of us are capable of so much more, but we just sit in our little comfort blanket with our comfy slippers. And not all of us have to be Bill Gates or Jeff, do Apples and Amazons or MLKs, but we can do what we want in our own little life. And if that's actually just kind of broadening out, might be even living abroad for a month or sorting out our family and our wider network, then that's absolutely fine. We don't have to do these kind of crazy things. But I think I just really chime with that point in terms of like stepping outside of your comfort zone, and especially in those early years when you have, if we're honest, less financial constraints. Could be housing, could be children, could be even animals. Like that's even a financial constraint. Really kind of stepping out your comfort zone and trying loads of different things. Because that's like kind of, it doesn't matter. You can be 40, 50, but especially in those early years, you have far more kind of access to kind of try different things and actually realise what you like and don't like. So I think that's a great bit of advice. I think you've turned out all right, Nicola, regardless of that. But what do you think? I think you've had a good innings.
I've thoroughly enjoyed. I mean, it'll be 35 years. I've been doing it next month, and I've still got another 15 years to go. And I thoroughly, I still enjoy it, and I intend to still be within it until I retire. So, can't be bad. I still wake up in the morning, look forward to go to work. Every day is different.
Yeah.
And I would thoroughly recommend it to anybody.
Amazing. And I think we kind of seek all this like happiness and all the rest of it and flashcards and all these things, which in my opinion kind of cover our insecurities. But if in terms of professional work, if we can wake up and look forward to going into work, I think that's so underrated. I think if we can just be content and happy, and I know that kind of might fly in the face of my get out your comfort zone and all the rest of it, but you know deep down if you're in your comfort zone and you're not kind of pushing yourself and you're not learning or growing. But if you can get to the point where you're thinking, you know what, I'm happy with where I am, I'm really looking forward to kind of going into work, then that's an amazing place to be. And before we kind of pull our session to a close, I suppose, and I just wondered, is there anything we haven't covered? I suppose, like we've talked a lot about requirements, an average week, your own background. Is there anything we haven't covered that you would like to discuss in terms of audiology?
Yeah, just one thing. I think what I haven't mentioned is the fact that not only can you work for the NHS, you can work in the private sector and you can be self-employed and you can start up your own business. So I think that's another, and I've done both. So I work for the NHS and I'm self-employed as well. So you can branch out, you can have your eggs in different baskets, you can get your income from different sources. And, then I think, it also future proofs yourself. If one thing doesn't work out well, you've got another thing to fall back on. So I think, in terms of income, as you were saying, you can work as hard as you like and you can earn some good money if you want to put the hours in. And if you want to spread yourself out. So there is earning potential, particularly if you set up your own business and that sort of thing as well. So I think it's as big as you want it to be.
Yeah. And that's a really good point, I suppose, to raise as well, especially in the careers, in terms of how careers has kind of changed the whole, you find a job and stay there for 30, 40 years. I think that shifted from you stay at a job for 30, 40 years to you find a job and you swap position, not necessarily like a company, but you might swap position every 1 or 2 years. Well, I think that's even shifted even more now to in terms of portfolio careers. So it's not just staying at one job for 1 to 2 years. It's actually working in 1 to 2 different places, having multiple sources of income. And I think if anything, COVID has accelerated or that kind of growth to portfolio careers. Because if you're relying on just one income, yes, you think it's a stable job and all the rest of it. But if anything was to happen, and obviously we're hoping an event like COVID doesn't happen anytime soon or ever again, but you're completely gone. All your security is gone because of that one income. Whereas, like you said, if there's multiple, you're self-employed or you work a little bit as a practice or as a wider employer, there's multiple streams. And it not only allows you to be more entrepreneurial, but it also actually gives you more security because there's multiple avenues. So I think that's a really, really good point to add just for people who are thinking, I'm just going to be stuck working for NHS, just one place, that's it. It's not the case. Absolutely not the case.
No.
Perfect. So thank you for your time, Nicola, and for being so transparent and honest and kind of sharing your experience around the world of audiology. And if anybody wanted to kind of get in touch and was perhaps interested and just wanted to have a kind of quick chat with yourself, where's the best place for them to reach out to you?
I think contact me on LinkedIn.
Yep, perfect.
Just look up Nicola Yarnall and you'll find me. Happy to help.
Beautiful, good stuff. And I'll make sure to include a link to Nicola's LinkedIn in the show notes. So if anyone kind of wants to reach out and is interested in audiology, and if you live in Essex, she might snoop you up. She might sweep you up. She's thinking, "Oh, I want that comfy person." You've heard. Be careful. You've heard what Nicola said. Now she got forewarning. She's going to make you nice and comfy.
I'm going to set up a dating agency. I'm going to do everything.
There you go. There you go. So thank you again for your time, Nicola.
Thank you.
And hopefully that was another kind of useful and insightful episode for those who are listening. And I look forward to seeing you and hearing you on the next episode of Catapult Your Career. Cheers all.